Great, thank you everyone for joining us. A very warm welcome to all of you for the official launch of the Mindful Campus Initiative. I'm Deanne Fisher, I'm vice-provost Students and International here at OCADU, and I'll be your host this morning. I'd like to begin by acknowledging the ancestral territories of the Mississaugas of the Credit, the Haudenosaunee, the Anishinaabe, and the Huron-Wendat, who are the original owners and custodians of the land on which we live, work, and create. Take a moment to welcome our guests, the Honorable Carolyn Bennett, whom we've just had the opportunity to tour, Minister of Mental Health and Addictions and Associate Minister of Health, Barry Patterson, Executive Director of the Center for Mindfulness Studies, and I'm not sure if Michael Derrick is here from York University. Members of the OCADU student body, thank you. We truly acknowledge that it is your midterm break, so we're very thankful that you're here with us. Including members of our Welcome Squad and OCADU Live, and members of our faculty and staff. So at this moment, I'd like to invite the Honorable Carolyn Bennett to the podium to make the official announcement as I'm introducing you. Minister Bennett is a long-standing member of Parliament who has represented Toronto St. Paul's in the House of Commons since 1997. Not only is she actively involved in her constituency, but she is a longtime friend of OCADU. Apparently has been to Gradix on the day of setup in the past, so knows something about what that stress feels like. Even before she became Minister of Mental Health and Addictions and Associate Minister of Health in October 2021, she was well known as a champion of mental health and healthcare reform, working tirelessly to advance policies and initiatives to improve access to care and support. Please join me in welcoming Minister Bennett.
Oh, thank you so much. Avant de commencer, je tiens à souligner que nous sommes sur le territoire traditionnel des Mississaugas of the Credit. J'aimerais donc rendre hommage aux peuples autochtones qui ont pagayé ces eaux et dont les mocassins ont foulé cette terre. Thank you so much for welcoming us and to this institution that just keeps getting better. I think one of my proudest moments was when a patient of mine won an award for a stool that she'd created with sheepskin, and I remember just thinking, oh my word, like there's actually a place where you can go and learn how to do this and be able to, I think, as we know, interpret feelings and interpret really what is here in the world and our relationship with the land and the water as well as with one another. And so I just think that this is, you know, so fantastic that the educators, the students that are joining us now, and that it is, I think, the journey of OCADU to actually this tireless, really, journey to inspire and educate and guide future generations, and everything you do to push advances in culture, technology, and quality of life for all Canadians. I have to admit, my son Ben graduated in theater arts at York, but you know, please don't hold that against me. But it is fantastic having been married to the film business for 43 years. The idea of being able to tell a story and in visual arts, I think, and whether it's jewelry, whether it's the things that we just saw, it's really so impressive. I think even in our short tour this morning, we realized really what COVID has done in terms of the social disruption, the increase in stress, the anxiety, depression, loneliness in these years that young people were particularly vulnerable to these disruptions that were caused by the pandemic, and remain among those most likely to say that they are struggling. En plus des quarantaines de la distanciation sociale, les élèves postsecondaires ont eu à vivre avec l'isolement social amené par la fermeture des collèges et universités. Ils ont aussi dû endurer des défis économiques incluant la perte d'emploi ou la difficulté à en trouver un. It's amazing to see that how through it all the students have been resilient, found new ways to support one another in their communities, found ways of working at home, even though the technology or the supports weren't there, but they could work in their minds on what they would want to do when they get their hands back on. That it is but it's been stressful, and we know that this has had serious implications on mental health and substance use. I think we know that now more than ever, we have to prioritize mental health so that we can create the conditions to improve student success and well-being today and well into the future. And I think that we believe that there was something about COVID that allowed all of us to maybe just express a little bit more about our mental health or our substance use and be able, hopefully, to reduce that stigma that has been such a barrier to people getting help when they need it. So today, we are announcing that the government is providing nearly $4 million to the Ontario College of Art and Design University. That's great, eh? Yeah. And for its new Mindful Campus initiative. I have to say we've tried that in the parliamentary precinct. It's not going so well. So once you prove it here, I think that it'll be good to move to our campus there in Ottawa. But this incredible project will help to provide post-secondary students at OCADU with the tools they need to build resilience, learn coping skills, and build a community that empowers students to support each other. I always think that, you know, as a family doctor and as a teacher of family medicine, that it was very important for us to learn how to comment on somebody's affect. You look happy, you look sad, you look worried. And it's really the fastest way of establishing rapport, that someone noticed. And for us to be able to teach one another how to reflect on how someone else is feeling, actually knows that kindness is one of the great medicines for our own mental well-being. And I think that it is so important as we go forward that people graduating from all post-secondary institutions are in some ways what we're saying, imbued with mental health literacy, are better citizens in terms of how they can not be afraid to talk about mental health, but also be able to help one another. So, il inclura de soutien par les pairs, de matériel de promotion de la santé et de la formation à la pleine conscience pour ultimement créer un environnement où les artistes et les designers créatifs et émergents, que ce soit le personnel ou la communauté étudiante, pourront apprendre, grandir et fleurir. I love the idea that sometimes just straight translation doesn't work, so I must admit that I kind of like learning the French word for pleine conscience, the idea that you're fully conscious of your feelings and where you are, and we're going to hear a little bit more about that. So I was, I think I could spend weeks here and still learn, but in our little tour to be able to see really how the COVID actually helped people with their examine their relationship with nature and foraging, as we saw in the Ignite Gallery, but also my favorite place in the whole world, the Georgian Bay, to actually see the interpretations of Awenda Park, just made me feel at home, almost with goosebumps of the various interpretations of the place that I love. And so we are very excited that OCADU is going to be able to deliver this program in partnership with Concordia, Faculty of Fine Arts, York School of Arts, Media, Performance and Design, Nova Scotia's College of Art and Design University and Seneca College. As the Prime Minister announced earlier this month, the government is committed to working collaboratively with the provinces and territories on shared health priorities to improve integrated healthcare for Canadians. And that means that these new agreements, $25 billion, will have the ability to transform our universal healthcare system by integrating the patient-centered, trauma-informed, culturally relevant mental health and substance use through all aspects of health and healthcare. And so we know that will lead to the improved access to mental health and substance use care through primary care, to have that primary care team have the ability to help people with mental health and substance use, to actually be able to support the people on the front lines of health and healthcare with mental health supports, as well as better sharing of health information between health professionals. Les ententes vont aussi réduire les risques liés à la consommation de substances, prévenir les surdoses, réduire la stigmatisation et aider à sauver des vies. We are really aware that more needs to be done, and we will continue to do whatever it takes to ensure that all Canadians, including those who have faced injustice for far too long, have access to the mental health and substance use supports they need to survive. As you know, that we want everyone to know that they're not struggling alone, that you are not alone, and that while COVID's been difficult for so many, it has been able, I think, to just open us up to be able to understand the resources that are out there, to be able to help people navigate to the things like the Wellness Together portal or the Pocket Well app, but also to be able to know that we have to create campuses that are inclusive and that do provide the supports in a meaningful way that's integrated into what is the lived experience of students. So I just want to say that thank you, OCADU, and your partners for taking this initiative to support the mental health of students. Soutenir des projets comme le vôtre est essentiel alors que nous travaillons pour nous assurer que tout le monde au Canada a accès à du soutien en santé mentale de qualité. Together, we can lay the foundation for a brighter, more resilient future, not just for students, for all people in Canada. And as your project evolves, that it will sort of pollinate campuses all across the country. And we are I'm not allowed to use the word contagious anymore. So, but pollination is something we kind of think is a good idea. We have that proof of concept here that we can actually influence the kind of culture of collaboration and kindness that you have here at OCADU. And so thank you. Merci, miigwech.
Thank you so much, Mr. Bennett. Pollination also goes with our nature theme that has been so very quick on the uptake there. As we emerge from the pandemic, students continue to face an uncertain world with climate change, rising costs, global conflicts, and we saw firsthand how the pandemic deeply impacted art and design students specifically. They went from creating and making with their peers and faculty members in studios and shops, some of which you've just seen, to creating in their bedrooms and kitchens, missing out on important social and community connections on campus and learning mostly online. So the Mindful Campus Initiative is a very timely program because it will help emerging creatives develop skills and techniques that will support them in flourishing and adapting within today's challenging times. I want to also acknowledge that Mindful Campus is being developed in partnership with the Center for Mindfulness Studies. The overall program is modeled on mindfulness-based interventions for young adults developed by the center, and the center is adapting these courses to deliver mindfulness-based training and practices specifically for art and design students. We will be offering in-person and virtual group classes where students will learn about mindfulness and how to practice it. They also have access to a series of videos they can watch on their own time and at their own pace. And we will be implementing an awareness campaign about the benefits of mindfulness practice. We will also offer mindfulness training to our staff, including those in the Student Wellness Center and new Student Wellness Peer Mentors. OCADU is piloting this training in March, and then the program will roll out this fall within our partner institutions in Canada, as you've heard, Concordia, Faculty of Fine Arts in Montreal, NASCAD in Nova Scotia, Seneca's School of Creative Arts and Animation, and York University School of Arts, Media, Performance and Design, also in Toronto. We are very grateful to Minister Bennett and the Public Health Agency of Canada for supporting and investing in the health and well-being of art and design students. So I want to thank you very much. And I'll introduce Barry Patterson. It's my pleasure to introduce Barry, who will share more about the Center for Mindfulness Studies' involvement in this initiative. Mr. Patterson is the Executive Director of the Center for Mindfulness Studies and has more than 20 years of experience working as a leader in public, private, and nonprofit sectors. He is passionate about the center's important work in helping individuals and communities nurture and regain their well-being. Please join me in welcoming Barry to the stage.
Good morning. It's my pleasure to be here today. I'd like to acknowledge with big gratitude the Honorable Carolyn Bennett and the Public Health Agency of Canada for investing in the well-being and mental health of students who have been greatly impacted by the pandemic. Your support of the Mindful Campus will help us to give tools and skills to artists and designers for their emotional well-being so they can thrive now and into the future. I'd also like to thank OCADU for partnering with the Center for Mindfulness Studies to bring the innovative approach of mindfulness programs to not only OCADU, but the partner institutions across Canada, specifically for creative arts students. Mindfulness training has emerged as a powerful, evidence-based tool for enhancing psychological well-being. It has been shown to increase personal resilience and to develop skills for everyday life, reduce the negative effects of stress, and assist with a variety of conditions, including anxiety and depression. As well, the group-based experiential learning program model allows members to learn from each other, provide support, and share resources while fostering a sense of belonging and understanding that we are not alone in our issues. Mindfulness training and practice through the Mindful Campus program will give students essential tools for coping and resilience. Students will learn mindfulness skills that can be integrated into everyday life, fostering a sense of well-being, practical ways to manage stress, ways to enhance awareness of experience and opening up to wonder and joy, to develop healthier ways of responding to challenging experiences, and to improve attention and focus through guided practices, and also to learn tools for enhancing compassion and kindness for self and others. Since 2011, the Center for Mindfulness Studies has provided mindfulness training to more than 20,000 people, and we have delivered mindfulness training programs that span the continuum of needs from promotion to prevention, treatment, and maintenance. We have also leveraged the power and resourcefulness of peer leaders to sustain and support the well-being of their own communities by training them to deliver mindfulness-based practice support sessions to their peers. This capacity building approach is also a key ingredient of the Mindful Campus. We look forward to working with students, faculty, and staff at OCAD and our partner institutions. And once again, thank you for your generous support, public health agencies, for bringing the Mindfulness Campus to life. Thank you.
So that concludes our formal remarks. Before I turn the floor over to a moderator who will jump up, there you are, who will facilitate questions, I would like to thank you all for coming this morning, and especially to Minister Bennett for spending time and like your engagement and intuition as you just walk through this brief tour makes me think you need to come back for a longer visit sometime in the future. So I'll ask the moderator to open up the floor. Thank you very much.
Thank you. We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You'll have the opportunity to ask one question with one follow-up. Let's proceed to the first question. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer à la première question. There are no questions here in the room. We now head to Zoom to the online moderator.
Thank you. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. We will now proceed to questions from journalists online with Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. Richard Raycroft.
Hi there, it's Richard Raycroft with CBC News. Can you hear me okay?
Yes.
Yeah, my question is for Minister Bennett. In the last election campaign, your government promised a $4.5 billion mental health transfer. Just to clarify for me, how much of that money is flowing and where is it going to?
So at the moment, in 2017, there was $5 billion in a mental health bilateral agreement that is continuing. That was over 10 years. So at the moment, $600 million a year is continuing to flow to the provinces and territories. There has been, I think, a real understanding of the need for proper health transformation. And that means that in the $25 billion that is now part of the bilateral agreements, as well as the increase in the Canada Health Transfer, that $25 billion now will ensure better mental health in primary care teams and the attachment of Canadians to a primary care team with additional mental health supports. It will include mental health supports to those on the front line of health human resources. It will include the kinds of indicators around wait times for mental health supports, unmet need in the Canada Health Survey, as well as the kind of data that will be able to finally deliver the kind of e-health, e-prescribing, but also being able to have the data that makes sure of the transparency and accountability, the dollars for health and dollars for mental health actually get to the ground and improve the health and healthcare of Canadians.
And just to follow up on that, you talked about proving it here and then taking it to the parliamentary precinct. On the concept of proving it, what sort of indicators, if any, is your government going to be looking at to see if this increased mental health funding is working?
Well, I think that, again, that we are, number one, really hoping for increased mental health literacy across the country. So mental health literacy, we now have on Parliament Hill in a handbook of mental health literacy for parliamentarians to actually make sure they're using the right words, that the stress even here for an exam is not an anxiety state. The grief one feels after someone you love has died is not a depression. We want people to really understand what is mental health and the difference between mental health and mental illness. This is about raising the mental health literacy of all Canadians. It means that we have to change our understanding of who are the mental health workforce. That is from knowledge keepers and elders to pastoral care, but also, you know, in my riding last month, I was able to go to the barber shops in Little Jamaica where there's a you know, the banner says more than a haircut. We have to understand we want everyone to be part of this, of increasing the mental health of all Canadians. So the kinds of indicators that have been identified so far are the wait times for mental health care, the unmet needs survey and the Canada Health Survey. But right now, we will meet with the Canadian Mental Health Association this afternoon. There are many people who are going to help us with the other indicators that we need to be able to measure, things we're measuring now, things that we're going to have to design how we measure it, but including how we are dealing with campus mental health. How are we dealing with in terms of secondary school, in terms of even early learning and childcare, and how we can help all people on the front lines have the resources they need to be able to improve the mental health of children, youth, and all Canadians.
Thank you.
Thank you, Richard. Dernier appel pour des questions sur le Zoom. Last call for questions on the Zoom. No more questions on the Zoom. Back to you, Tom.
That concludes today's event. Thank you. Ceci conclut l'événement d'aujourd'hui. Merci.